Additionally,
we have a very big target, which is that we want to expand that, and that's part of being here in Nairobi and starting a regional hub. We want to expand that to reaching health systems that reach 350 million people by 2030. So we have a very ambitious objective, and the only way that we can do that is if we work through others. So for example, in Mozambique, we started first working on immunization supply chains just with provinces, helping them improve their immunization supply chain. Over time, the National Medical Program, the National Medical Store, they actually seek out information from those who are not accessing healthcare services. They seek that information out and they respond to that and integrate and change how they're delivering services to meet the needs of those that are hard to reach. So at VillageReach, we believe this is what responsive primary healthcare looks like. And we believe it's so important that we've made it the cornerstone of our 2030 strategy. And why? Well, because we know we won't reduce child mortality, we know we won't prevent preventable deaths if we don't focus on where the outcomes are the lowest. As you heard from Claudia, we started our work in Mozambique 23 years ago. And when we started working in Mozambique, there were about 160 children per every 1,000 born that died before their 5th birthday. Now fast forward 20 years, and through the collective work of the Mozambican government and all of their partners, that number has decreased. It's about half of what it was. About 70 children for every 1,000 born die before their 5th birthday. But what does it actually take for Mozambique to get where Kenya is? So in Kenya, about 30 children die of every 1,000 born before their 5th birthday. So what does it take for Mozambique to get from 70 to 30? And then what does it take for Kenya to get from 30 to 15? Or from 15 to 5? Well, we know that it's not the same strategies that you need to use to get those first 100 kids as it is to get those last 5 or 15. So we need different approaches.
To do that. So I'm trying to say that most generally it will be similar challenges, but we understand that there will be nuances that are required because there will be some things that are a little bit different in Kenya, but we'll adopt the listening.
How it worked to collect data, to understand the operations of it, and the ministry said, we like this, we want this to be a national program. And then they brought it into their health facility, into their structure. They pay the hotline workers, not VillageReach. It is part of their national health system now. And that's how you get scale, and that's how you get reach. So that's what we're really proud of, is both the direct impact we have, but also the way that our partners are able to take this work to a larger scale.
For broader service delivery, this aligns with our commitment to strengthening grassroots health care. Secondly, we see the potential for collaboration in leveraging ECHIS data for targeted interventions and health promotion. The utilization of data-driven insights will further enhance our ability to address specific health challenges and improve health outcomes. Lastly, we see potential for joint research and development by partnering on developing and testing new healthcare solutions.
Delivery to reach everyone. Together we can spark change that resonates across the continent and beyond. VillageReach and I personally.
late last year, we engaged several stakeholders from the public and private sector, development partners, and donors through a perception survey to consider the future involvement of the private sector within Kenya. Our goal was to support the Ministry of Health in leveraging this platform to assist in making well-informed decisions and formulating effective policies for leveraging the private sector. Let me conclude by saying that we view this work in Kenya with the Kenya Ministry of Health and all our partners as just the beginning of improvements in healthcare delivery. We look forward to expanding our solutions and programs.
Working in health systems in Africa for over 20 years. And what we've come to understand, and what we've sort of built as a cornerstone of this 2030 strategy, is that the best health systems, the health systems that reach the most people and that have the best outcomes, have three key qualities. First of all, they make sure that health products and services are available when and where they're needed, even to the hardest to reach people. And I know we have many partners in the room, we have InSupply here, partners that are working on that vision right there. Partners like Living Goods, I'm sure many of the others. Let's make sure that health products and services are available when and where they're needed. That's one of the qualities of strong primary healthcare systems. The second key feature that we've seen is that the best healthcare systems adapt. They adapt to shocks and strains. They adapt to changes in demand. And this is so important today. We know that the world is changing around us. We know that there are disruptions that we can't predict, and they're available when and where they're needed, even for the hardest to reach communities. So they're reaching beyond a sort of one-size-fits-all. They're really thinking about how do we get out to where people are? How do we think about, how we're making those products and services available? So community health workers, using digital methods like hotlines and telemedicine, those are ways that you're really thinking about how are we shifting the availability of products and services. The second thing that they do is that they really adapt well. So we talked a little bit about all the way to the community level, and to drive tech-enabled primary healthcare solutions to the most underreached communities and engage those communities in the design and delivery of primary healthcare as they want to see it. So we're really excited to be here in Kenya. Thank you to all of you who joined us today. We're excited to both work to support the priorities of the government of Kenya, but also to join hands with all of you and all of the partners that have made Kenya their home in order to transform healthcare delivery together. And since partnering with government is such an important part of our model,